So, this is my second video. The first one was introducing myself, and now I just want to kind of reflect on my first full week as someone enrolled in a PhD. I was down at uni on campus and sitting within summary, so I had a lot of people around me, which was fantastic. I met with both supervisors, Alex Brown and Mari Williams, who are both really fantastic as well, very different, which is probably a good thing, and kind of started to think, and it's funny, everything I thought I was sure on, I'm no longer sure on, which is fine. It's only been 1 week. I have 6 months to put together my research proposal. So that's kind of what we're focusing on at the moment, is getting to know each other, doing all the boring stuff like the research induction plan, blah, blah, blah. Having to sit through a day of stuff that I probably should have just read online. Although I did meet a really interesting woman who certainly is someone I'd probably would be interested in talking to about a PhD. So she's done a PhD, and she's also a supervisor, and shared some of her personal experiences. So I was just thinking, about all the stuff that I've done this week. And as I said, everything I thought I was sure on has gone out the window. So a little bit of background about my PhD. I am going to look at the national KPIs for Aboriginal and Torres Strait Islander health services. There's 206 across the country which are funded primarily to service Aboriginal and Torres Strait Islander peoples. So there is 19 KPIs with some subsets. So it's something that has come out of the community controlled sector to look at those. How I'm going to look at them, what I'm going to focus on, I'm not sure. Haven't got that far. I need to obviously talk to my supervisors, look at the literature, also talk to community. Talking to community controlled health organisations and peak bodies is really important to make sure that what I'm doing is actually something that's useful for the sector. It's got to be something I'm interested in, but I also want to see that the Aboriginal community controlled health sector sees value in what I'm doing. It's something that, I guess, having worked in community controlled for such a long time, I've been indoctrinated, and if it hasn't got a practical or a useful application, I don't believe I should do it. And the other thing is I need to engage with the community controlled health sector because the topic's so broad that I think it's really important to make sure that if I'm going to narrow the focus down, that it is one of their priorities, and I'm sure there's a number of priorities. And I've been reminded over the course of this last week that I don't have to solve all the world's problems today, tomorrow, or in the course of my PhD, that hopefully I live for another 50 years and I can tackle some more. So focusing on what the core priorities are is really where I'm at the moment. It was really good being down at Summary, actually, because I was surrounded by a lot of academics who were obviously really supportive and really interested, because this is what they do for a living, is research. And while I don't necessarily think that everything that I spoke to people about is going to be useful in the short term with this particular project, I had a lot of amazing people give me some really good advice and just even discussed theories, methodologies that would be helpful. So sometimes, I think having people to bounce those ideas off that obviously know the stuff really well, to kind of nut out your own concepts was really good, and I certainly am very lucky to have access to that. It's amazing. People in our sector tend to be extremely passionate. You certainly don't do it for the love of the money, because there's not as much money as, say, working in the business sector, private sector, but you certainly do it for the love and for the need. And I guess I've started to think of myself more so as a social justice campaigner. And yes, probably throughout these you're going to hear the soundtrack that is going to be the soundtrack of my PhD. So this is that song's quite an old song, but If you don't know it, it's Grinspoon's Champion. And I guess in some way it's apt, because whenever you tend to take a PhD, you kind of become a champion for a particular topic or a cause. So, and I certainly see myself as someone who is a social justice campaigner. And undertaking the PhD, I won't be just looking at the NKPIs in itself, but also the processes and the ideology that goes into the development of something like a KPI. When you look at policy development, I believe personally that there is underlining ideologies to all aspects of that policy or program, and I think it's really important to identify what they are, because sometimes they're intentional and other times they're unintentional, and both probably have certain risks that need to be considered. I mean, at the moment I'm really curious as to what the value is of an NKPI within the health setting. So I'm really going to start researching over the next couple of weeks how key performance indicators came into the health space, how they were adopted, and to see what the evidence is to support that they actually demonstrate impact, outcome, or in the case of the NKPIs, drive quality improvement. And who defines what is quality, and what are the inclusion and exclusion criteria. So, you know, that's pretty much summing up where I'm at the moment. I guess I'm riding on a little bit of a high at the moment. I'm really excited. It's all new, it's all fresh, and I'm sure in 6 months or even, just a couple of months when, I'm tired, and things are coming, to a point where I have to submit certain things, I'm going to be probably feeling a lot less enthusiastic. But I think that is part of the experience, and I'm looking forward to all of the experiences, some more than others, but yeah. So that's me, my first week, and let's hope I'm still smiling next week.